turned entrepreneur, and I have done sales job. It was an international sales department, and basically I have learned as a pharmacist. There is a huge demand in healthcare for revenue cycle management. So this is the only sector where which is non-clinical thing.
So, being a healthcare recruiter, I'm telling my experience that I know about the pharmacist. I catered their resume as well. But this is pretty interesting that they can come into the coding industry, which is AI proof. Now,
Yes.
I think this is the basic need of, uh, if I talk about future era.
US healthcare providers, they are facing many problems. So especially small clinics, large hospitals and everything, they have a huge system. Everything is working fine, but no one is looking out for small clinics.
Exactly. So, welcome to our podcast. Today with us is Dadi Sumanth Naidu. He is founder of RCM Consultant at CYPTRIX, and he is as well founder of Synaptoria Edtech. So I welcome and I am very glad to explore this new thing because this thing is also very new to me and this attract me so much. So today our guest is here. And for our viewers, I will just explain them that the topic of today's podcast will is mastering the revenue cycle, basically revenue cycle management and building AI proof career in healthcare. So, Sumant, once again, I welcome you and my podcast. So,
Thanks for having me, Meenu. It's been a pleasure to be here.
my first thing, I'm very eager to understand from you that how is your journey started, and as an entrepreneur, I can say, or as a founder, how you start in healthcare.
Basically, I'm a pharmacist turned entrepreneur, and I
Mhm.
have done sales job. It was an international sales department, and basically I have learned as a pharmacist there is a huge demand in healthcare for revenue cycle management. So this is the only sector where which is non-clinical thing.
Mhm.
We will have a work-life balance. We
Mhm.
won't be having long hours, so
Mhm.
we won't be dealing with any machinery or chemicals. So
Mhm.
everyone in from the pharmacy sector are choosing medical
Mhm.
coding as a career, and
Mhm.
I wanted to choose it too. But with my contacts here in the United States, so what I
Mhm.
have done is I have established my own revenue cycle management company after
Mhm.
studying it for a while.
Okay,
And
great.
yeah,
Mhm.
I have my partners. They have been working in the RCM companies for more than 10 years. So,
Okay.
with their support and my vision, we have started CYPTRIX. And after CYPTRIX, we found that there is
Mm.
a lack of knowledge in the freshers. So, we wanted to train the freshers too.
Mm.
So, that's how it started. Synaptoria also began.
Mm. Great. So, being a healthcare recruiter, I'm telling my experience that I know about the pharmacist. I catered their resume as well. But this is pretty interesting that they can come into the coding industry, which is AI proof. Now,
Yes.
I think this is the basic need of, if I talk about future era.
Yeah.
This can be the benefit for all the newcomers. If we think about pharmacists, they have only one thing in mind: ki, oh, he can work only in the pharmacy.
Yes.
But
True.
I think our viewers should know about it, that there is a one more broad vision to be after doing pharmacist, they can enter into this field. So great, Sumant, you are doing a very great job. And what I want to know, what inspired you basically to focus on both the clinic revenue, as you said that when you have started this CYPTRIX, you are finding some challenges to recruit the
Yes.
people. So that's why you have started Synaptoria. That I understand. But this is the only reason, or you have some broad vision also to hire some fresher candidate. Matlab, what is your main vision basically?
So basically, the reason for starting Citrix was to help US healthcare providers. They are facing many problems. So
Okay.
especially small clinics, large hospitals and everything, they have a
Hmm.
huge system. Everything
Hmm.
is working fine, but no one is looking out for small clinics.
Exactly. Hmm.
And for them
This
to
is
have
very
their
even very
individual,
common in India as well.
yeah, true.
Hmm.
For them to have their individual billing or coding team, it would be really costly.
Hmm.
At the expense of two individuals in the US,
Hmm.
we can get an entire RCM team here in India,
Hmm. Hmm.
and they'll be only working for them,
Hmm.
dedicatedly working for the small
Hmm.
clinic.
Hmm.
So in this way, we have solved their problem. But I
Okay.
couldn't observe
Hmm.
this problem right here. We
Hmm.
have a lot of freshers, and the
Hmm.
only resource now India has is human resource.
Hmm.
We have many talented individuals, but
Hmm.
they have only theoretical knowledge, but not the practical
Hmm.
knowledge. There are many coaching institutes out there,
Hmm.
and they call themselves as saviors,
Hmm.
and but they'll only teach for just exam. Life
Hmm.
doesn't stop at the exam, right? Exam must open new ways. It must be a gateway. But
Hmm.
after even after qualifying the exam, they are unable to crack the interviews. I have personally interviewed more than 500 candidates, and I can barely choose 50 to 60 members. That's it. And most of the majority of them were CPC certified. That means AAPC, an American board, has certified them as a coders, as medical coders. But me, I'm a regular pharmacist, I'm not satisfied by their answers. And so that is when I have understood that there is no standard over here. So theoretical knowledge and practical knowledge both are really important. So it's like I have understood what lies on both sides of a coin. So in this way, I have started both. So this dual approach has helped me a lot.
Exactly. I'm finding the same that uh, after completion of examination, I got very fresher resume. So sometimes I am also feeling कि कभी-कभी ऐसा है कि some candidates आपको पसंद आते हैं, but
Yeah.
you cannot say yes to them because the criteria of the profile is like such that sometimes we need to hire only the experienced person in
Yes.
mostly in healthcare. So it is very difficult for a fresher to sustain in healthcare industry or start their journey from somewhere. So I
Yeah. True.
think you have given a very good platform to the fresher candidate.
And another
And
problem, what I have observed was experienced candidates lack the knowledge. So in this, especially RCM sector, we have to be keep updating ourselves every single day. So recently, new guidelines have been added. Every year there will be new guidelines. So last year they weren't from 2 years, like 3 to 4 years ago, there weren't any COVID guidelines.
mhm,
So
okay.
now there are COVID guidelines, and who knows, there could be more guidelines added. And every day we are discovering new diseases somewhere in the world, and in this way we need to be keep updating. The problem with the experienced candidates are they can't. When they reach certain age, they might refuse to keep learning. So
Exactly.
I feel like freshers, they are eager to learn, eager to work, but they are unable to find right mentor to guide them. So it
Exactly.
is where
That
Synaptoria
means
comes
basically
into.
you can mold them in the way you
Yeah,
want.
in the
Hmm.
exact way what market needs them,
Hmm.
not just
Great.
Citrix, anywhere. Either it could be Optum, Coro Health, or
Hmm.
any global companies. They
Hmm.
have a set of standards to be maintained by the freshers, which
Hmm.
they clearly lack, and they
Hmm.
are not being taught in the colleges. because
Okay.
that isn't covered in this syllabus.
So you have worked very closely with the healthcare, right? So
Right.
I want to know that what are the common mistake in medical coding and in billing you find these days which bring denials to the clinics or a company?
So basically, in the small clinics, I have worked really closely with the small clinics in the US, and they have very minute mistakes. So they would be overcoding or undercoding. So due to this, the hospital or the management could be underpaid or overpaid, or sometimes the entire claims could be denied just because there is the coding isn't proper way. The
Mm,
coding won't be in a proper way because documentation wasn't in a proper way.
not in a proper way.
Yeah,
Exactly.
right at the beginning.
Hmm.
So a
Hmm.
problem starts right before patient meets the doctor.
Hmm.
And at Citrix, we have focused not only on coding after receiving the documents, we also analyze how our doctors are
Hmm.
entering the documents. So we just stop the problem right before it begins.
Okay, that means one certification you have spoken, right?
Right.
Uh, like CPC certified,
Yes.
and that is the basic certification you said for the coding for US based companies, right?
True. Yes.
So, what is the name of your certification which you are providing the who are enrolling in CYPTRIX?
So basically, CPC certificate is a certified, which means certified professional coder. It is an exam conducted by AAPC board. It is situated in America, and which states that which qualifies you as a certified professional coder, basically.
Mm-hmm.
So many companies, most of the RCM companies, they prefer CPC certified coders over the regular freshers
Mm-hmm.
because this exam is conducted by US, and we are working for the US.
Mm-hmm.
So this has become the basic standard. But the exam fees of the CPC exam is more than 500 US dollars. And with,
Okay.
including the coaching fee, it would be around 30,000 more.
Mm-hmm.
So an average student would be
Mm-hmm.
spending more than 1 lakh Indian rupees
Mm-hmm.
to get a job as a fresher. So do
Mm-hmm.
you think it's fair?
No, completely not. If a
So
fresher, if he has such amount of money, then why will he will with resume he will search the job here and there
true,
because he has already invested in her
right.
initial
Then what
primary
about the
education.
4 years of
Hmm.
education? 4 years of education and before that,
Exactly. Hmm.
so which doesn't make any
Hmm.
sense. So I felt like there is a need for another certification
Hmm.
without exploiting them,
Hmm.
because we are working, though we are working for US, we are
Hmm.
working in India, right?
Yes.
There is an exam called
Hmm.
GMAT
Hmm.
for students who want to pursue MBA in
Hmm.
the abroad. They'll
Hmm.
write the GMAT exam. It is also
Hmm.
conducted by American board.
Hmm.
They'll
Hmm.
write the GMAT exam and they'll pay the US dollars because they are moving abroad. But here we are writing CPC exam. We're living in the US. We're earning in the rupees, but we are paying the fees in US dollars. So
Great.
that's why.
So what is the duration of this program basically?
So that's why we have
Hmm.
started our own program in the Synaptoria,
Hmm.
and we certify them, which is called
Hmm.
Synaptoria Certified Professional Coder,
Okay.
and which includes same portion, same syllabus. We include
Hmm.
ICD, which is International Classification of Diseases, and
Hmm.
CPT, which is Current
Hmm.
Procedural Terminologies. So these
Hmm.
are the books, and also book called HIPIX. So
Hmm.
these are the books which are involved in the CPC exam,
Hmm.
and we prepare the question paper based on those books itself.
Okay. As per their
So,
standard. As
yeah,
per the
as per,
standard of.
in
Hmm.
fact, more than that.
Okay. Great.
And we also include internship in it.
Hmm.
While
Hmm.
students learn at Synaptoria,
Hmm.
they'll also be
Hmm.
working on projects from the CYPTRIX under mentorship or CPC certified coders.
Okay. So means they do not have to roam around here and there for
Yeah.
internship also.
So basically, right after completing the course, they'll
Hmm.
be job ready, and
Hmm.
we choose best candidates and we hire them for ourselves.
Great. And how much time that course take to complete? Is there any
It could
duration or?
take, yeah, there is a duration. So
Hmm.
basically, On average, it would take around 45 days.
Hmm.
And we train everyone online from
Okay,
Kashmir to
great.
Kanyakumari.
Hmm.
So everyone who has access to internet, we have our
Hmm.
own app launched in the Play Store right now. They can
Hmm.
download the app and attend our free classes too. And the demo, we have mock tests, and we even evaluate what are the time, the amount of seconds duration they spend on each and every individual question on the individual topic. In this
Okay,
way, we will give them a tailored approach towards learning.
great.
So we
And even
understand
they
what they
can
like.
work remotely, right?
True. And the best
Hmm.
part about this job is this is the only role where a pharmacy or life science graduate can work remotely.
Okay.
And basically, 60% of the pharmacists are female.
Hmm.
They prefer working from home.
Hmm.
So this is their best choice. And
And what are you find that there are some quick wins which can reduce the basically the claim denials.
basically, yeah, outsourcing would be the best part, because
Mm-hmm.
what is the main role of a doctor?
Mm-hmm.
Treating patients,
Yes, completely
right?
agree. Mm-hmm.
That's their main role. But what if we make them do all the billing, follow-ups with the insurance companies,
Mm-hmm.
and all the documentation, everything?
Mm-hmm.
What if we make them do it? He must compromise on treating the patients.
Certainly.
There might be an error. If he causes a
Exactly.
minute error,
A medical
there
person
might
is
be
very
denied.
difficult to do this non-medical job, sitting long hours and
Yeah,
doing
sitting
checking all
long
the
hours,
paperwork. It is
paperwork is
difficult.
worse.
Hmm.
So if they
Completely
could
agree.
just outsource this process,
Hmm.
there will be CPC certified specialists working on this
Hmm.
process. And there are like 7 to 8 steps of the RCM process. There will be individual contributor for this from the CYPTRIX.
Hmm.
So in this way, there won't be any chance of denial.
Great. And you were securing the placement as well, you said, in
Yeah,
top
true.
MNC in US healthcare client.
Yeah. And we
Great.
also act as vendors for many companies. We do their
Hmm.
process in here, and in this way, we have established connections. So whenever they require freshers, whenever there are any openings,
Hmm.
we recommend our best students for them.
Okay, great. And what trend do you see that in healthcare operation in next coming 5 years?
Basically, in next 5 years, I could say AI will be used as a standard. AI will be standard in every
Hmm.
industry, not just healthcare.
Hmm.
In every industry, AI would be a standard. And coming to this, a medical coder who will use AI will replace medical coder who won't use AI.
Okay, completely.
So
Hmm.
we must keep improving,
Hmm.
because AI can't code. Here,
Hmm.
human intervention is
Hmm.
needed. Would
Hmm.
you, if you are in the US, just a
Hmm.
scenario, and there is a an emergency healthcare,
Hmm.
and a procedure must be performed, someone of
Hmm.
your family.
Hmm.
So, would you let AI to just take decisions?
Certainly not.
There must be human intervention, right?
Hmm. Yes,
So,
especially
as
in
of now,
healthcare.
yeah, as of now, AI is not in a condition to do the entire process with more than 90% accuracy. It is just
Hmm.
maintaining 15% right now.
Hmm.
But we can use it for improving the quality. First, we work on
Exactly.
it.
Hmm.
Next, it will monitor everything, make
Hmm.
sure everything is right. After that,
Hmm.
there is another step of human intervention.
Hmm.
That's how we do it, etc.
Hmm.
So we must adopt to the AI. That's the only way
So
we
that
can
means
survive and protect.
we should not fear about AI, right?
We
We
should
should
not. We
use
must
AI
embark it.
like a tool.
We must embark it and move ahead. We must
Yes.
learn it. Everyone feared when
Hmm.
there were cars in the market,
Hmm.
right? There were
Okay.
horses back then. Everyone
Hmm.
feared
Hmm.
when cars came.
Hmm.
Everyone feared when computer came, laptop came.
Hmm.
A
Hmm.
typewriter's job was lost
Hmm.
because of
Hmm.
computers. But
Hmm.
we have an entire branch who are
Hmm.
using computer right now.
Hmm.
In the same way, few
Especially.
jobs might be lost,
Hmm.
but millions would be created.
Exactly. So, what you will advise that someone who wanted to start with a scratch, okay, in healthcare, what roadmap you will suggest to them to become a high paying healthcare career?
Uh, I would recommend concentrating primarily on primarily on the basics, on the
Okay.
healthcare standards,
Hmm.
HIPAA conventions, and
Hmm.
everything. So we must keep updated. We must
Hmm.
be learning every single day,
Hmm.
because it's not like another in the healthcare. We don't know what happens. Next
Hmm.
moment there might be, and healthcare is the only thing which could last.
Hmm.
When COVID happened, when there was pandemic,
Hmm.
every sector was closed, manufacturing, IT,
Hmm.
everything, but
Hmm.
healthcare was running. It is the only thing which
Exactly.
kept our India running,
Hmm.
because we have
Exactly.
become pharmacy capital of the world.
Hmm.
So even COVID can't stop healthcare.
Hmm.
There
Exactly.
won't be
Hmm.
diseases. Do you think there will be a day
I think
without
that
any
is the
disease?
time when people understand and understood that no, the doctors, nurses needs respect. They are truly in a divine role.
Yeah,
So this pandemic has truly taught us so many things. Being common people also now they understand how to control the infection in the hospital, what to do, what are the policy, and how much important our resources is in healthcare.
yes,
And maximum as being an healthcare worker, I have seen that nowadays in India as well, every near about 90% people in India having the health insurance. They are focusing
right.
about on health insurance. So obviously, certainly the demand of this type of profile is raising day by day
Yeah, true.
in healthcare
But the
as well, whether it is
difference
in India
from
or whether it is in outside the India.
Yeah, the difference is here we can directly pay the doctors. But in
Mm-hmm.
the US, it's the opposite.
Mm-hmm.
We go to the doctors, we get the
Okay.
treatment done, we claim the
Mm-hmm.
insurance
Mm-hmm.
companies pay the doctors.
Hmm. So you
So
mean
there
to
is a
say
huge
there is
circle.
no pattern for a cashless? They
Yes,
have to reimburse it only.
yes. No
Okay.
cash.
Hmm.
They have
Uh,
to they have to
this is
just
the
claim the
difference
insurance.
which you have you told me. This is also a very new thing for me to understand that in India there is a
I
cashless
wish,
system,
yeah,
but
I wish
in
it will be implemented in the India too.
India too. Okay, so we can produce more jobs for the healthcare
Yeah,
here.
true.
Hmm.
Because we have lot of uh, youth who are waiting for job right now, and by providing more employment for them, we can
Hmm.
stop the talent immigration.
Hmm.
See, my friends,
Hmm.
particularly those who are toppers. I'm
Hmm.
not a
Hmm.
topper. So those
Hmm.
who are toppers, they left abroad to learn.
Hmm.
They
Hmm.
went there. They have completed their
Hmm.
masters. Now they are working in huge
Hmm.
firms. They are
Hmm.
paying tax over there. They are being
Hmm.
good citizens. We have lost gems. What if they have worked
Hmm.
here?
Hmm. Certainly.
Right.
And how do you prepare students to face real life challenges as a remote healthcare roles? What are the real life challenges you face? And how you guide them to take the challenge and make these challenges as a milestone?
So basically, the most important thing is we must not work for a certificate.
Mm-hmm.
Our primary objective is to get a job.
Exactly. Mm-hmm.
And it is healthcare sector. There is no chance of errors or mistakes, or else we could
Mm-hmm.
cost a life.
Certainly. Very true. Very true.
So
Mm-hmm.
big, and there are no shortcuts over here.
Mm-hmm.
We must concentrate on gaining knowledge first,
Mm-hmm.
and then concentrate on exam next.
Mm, mm,
Automatically job and money will search for you.
mm. So, two basic things you have explored first certification is required, and the knowledge about the profile is also very important,
Yes,
right?
certification
Okay.
without knowledge is just a piece of paper.
Yes, exactly. So, tell me about your one decision that today you feel proud of.
Well, I had a good job.
Mm-hmm.
I was in a great position too, and
Mm-hmm.
they were about to make
Mm-hmm.
me a permanent employee too. But I
Mm-hmm.
have decided to quit and pursue my dream.
Mm-hmm.
I'm proud of it, and also sometimes I feel like it could also might have been my worst decision if it didn't
Mm-hmm.
work out.
Mm-hmm. Sometimes it can be backfire. Mm-hmm.
Yeah, it could backfire.
Mm-hmm.
I had support. That's the
Mm-hmm.
reason why it worked.
Mm-hmm.
Luckily, God was with me. So
Mm-hmm.
everything went well. If there is a person just like me right after completing college, they want to start their own company,
Mm-hmm.
I would recommend them to work at least for 2 years
Mm-hmm.
and have surplus money of at least 1 year and then
Mm-hmm.
start a company or any business,
Mm-hmm.
because there were a lot of challenges where
Mm-hmm.
I have worked as a rapido driver too,
Mm-hmm.
because of company expenses were a lot, and I couldn't, there was a situation where I couldn't pay salaries for my employees,
Mm-hmm.
and they were a lot more challenging. So yes, I have risked everything, risked entire thing and worked on this. So I'm proud of it. And also, if you think with practicality, it could also be the dumbest thing I might have done.
So uh, truly, you are an inspiring personality. I must say, कि, in healthcare industry, this is one can do this as a after completion of pharmacist. Truly, this is a great job which you are doing currently. You are creating jobs for the people, for the fresher. So, Sumant, I enjoyed too much with you, and moreover, it is a very interesting session for me as well to understand that what is the difference between the US healthcare insurance and reimbursement claim, and what is the difference between India now currently we are running with, and how you are creating the jobs for the fresher, how they can be a certified coders in healthcare industry. You guide us for that. So for our listeners, if you are a healthcare provider looking to optimize your clinic revenue cycle, so please connect with Sumanth Dadi. He is a founder of Synaptoria, and he is founder of RCM Consultant to CYPTRIX.
Right.
So once again, thank you so much, Sumant. Be with us. And one more question I will certainly ask you. But LinkedIn presence, how do you say that? No, it is a very basic requirement nowadays for to connecting the healthcare professionals in one platform.
That's actually a great question.
Mm.
Many students, uh, when I was in my fourth year of pharmacy, I didn't know what LinkedIn was. I didn't
Exactly.
even have the app.
Mm.
But I have gained a lot of connections using the LinkedIn. And half of my US clients, I have met them through LinkedIn, through my connections. So, and even I have met my co founder in LinkedIn.
Great. I think
So,
we are
LinkedIn
also
is the,
connected over LinkedIn.
yeah, we are also
So,
connected over LinkedIn. So it opens
mm,
new gates, new doors for
mm,
everyone
mm,
who's
mm.
looking for jobs or looking for development in their life. Yeah, that's the best invention, best app
Mm.
in the present generation human have invented. So
So,
every other app is for distraction, that's it, but this is for development.
thank you, Sumant.